Hi, welcome to Healthcare and Coverage Year in Review for Health Watch Wisconsin. I'm Bobby Peterson along with Bryn McBride.
Hello.
We're going to go through a lot of the major events of 2017 and recap you on a year of action.
Yeah, and we can't cover it all. There's too much to talk about, but we're going to hit some of the highlights and some of the lowlights. And we'll
Rewind
start
back to January
with the
20th.
lowlights. This is going to be part painful exercise, part inspiring, and it starts right on day one, Inauguration Day. This was a day that set the tone for the administration's priorities in the realm of healthcare and coverage. It started with an executive order signed just a few minutes after the Inauguration Day parade.
Massive crowds.
Said
all over the place. I mean, just huge hordes of people.
That said that it would give states the ability to repeal parts of the Affordable Care Act to the extent permitted by law. But the extent permitted by law part was the important part, which meant that it was just more of a symbolic gesture. It started that theme of flexibility of states to do what they wanted, which translates to waivers, to start changing your Medicaid program, some of the innovation waivers available under the Affordable Care Act, and then fast forward a couple months, we started seeing some of those waivers trickling in from our own state of Wisconsin as well.
Yep, and it also started a theme of, appearances and for effect and visuals that the administration really keyed on, and it was very symbolic.
It was symbolic. Yeah, I mean, I think people were worried that there would be an immediate repeal and replace attempt.
Well, and I think people that was part of the impression that was hoped to convey, because it would become a self-fulfilling prophecy then. But we'll see. Some things changed over the course of time.
They sure did. And we could spend the next maybe 10 minutes talking about the very disconcerting summer that happened. After that tone was set, we then saw a busy summer with high drama, especially in the Senate, of the attempts to repeal and replace the Affordable Care Act. In the House of Representatives, we saw the American Health Care Act, hotly debated, with provisions that some Republican conservative members said weren't, the Freedom Caucus and members said weren't conservative enough, and kept too many pieces of the Affordable Care Act intact.
You're right.
And then we saw the Better Care Reconciliation Act on the Senate side, many versions of it, from a more robust repeal attempt to a very skinny repeal attempt. And we had the very dramatic moment of Senate Democrats, Lisa Murkowski, Susan Collins, and very dramatically, John McCain voting no. So we did not get the repeal and replace that came out of that very busy summer.
Right. And it was interesting because, as Brent pointed out, several more moderate Senate Republicans walked back from the legislation, were concerned about some of the issues, particularly Susan Collins. And, John McCain ultimately had the big dramatic moment late at night when he gave the proposal a thumbs down. And Mitch McConnell was very disturbed by it. You could see by the look on his face.
These provisions, these repeal attempts, did almost as much damage would have done as much damage to Medicaid as they did to the individual marketplace. They included block grants or per capita caps, impacting millions of people, as the CBO was reporting.
Well, it was a misread of public opinion. I think that Obamacare had been people were opposed to Obamacare, but liked the Affordable Care Act, and as people discussed it more and more and heard about what the impact was for people, public opinion was really gaining favor towards keeping many aspects of the Affordable Care Act, and repair and not repeal was the watchword, I think, through the summer then.
Right, and public opinion was saying, if you have pre-existing conditions, you shouldn't be locked out of buying insurance. We started hearing that argument over again, and people started saying, yeah, that's right. The Affordable Care Act does cover people with pre-existing conditions. We don't have to segregate them into high-risk pools like we used to.
Yeah, we had the politicians that put the rose-colored glasses on and were looking back nostalgically at high-risk pools.
Our own insurance commissioner in Wisconsin.
And Senator
the good old days
Johnson.
of hers.
It's just really, I as someone who represented people during that time period, was around for a lot of the high-risk pools, they weren't that great at all. They were the only option, so they worked for some people at the time, but they were expensive. Some people died before they became eligible for them.
6-month wait.
So they weren't great at all.
Right. So let's then fast forward to what came out of the administration next, a market stabilization rule. So when the repeal attempts weren't successful out of this Congress, then some of the rulemaking started, and this market stabilization, ironically named, was introduced. It cut the open enrollment period, which is what most people know this rule as being responsible
right now, if you're watching this during open enrollment, and it's coming to an end very quickly.
December 15th, and so it restricted open enrollment for this year to 6 weeks.
Yeah.
it changed very dramatically special enrollment period eligibility. So if you miss your chance at open enrollment, you have to then wait for a qualifying life event to qualify for health insurance through the marketplace. They changed some of the eligibility for those qualifying life events, a little bit more conservative now, and with a much higher burden on the consumer to verify the change than ever before. So those were the two biggest changes that people know as coming out of the market stabilization rules. But there was more changes in actuarial values, network adequacy, change in how they even defined guaranteed availability. And when we're talking about these changes, we're seeing that the actuarial values, for example, a gold plan of last year now looks more like a silver plan this year. It just really took everything down a notch in quality.
Yep.
Those were the market stabilization rules, had a pretty dramatic effect on what will ultimately look like enrollment numbers. So before, we had about 12 million people able to be covered under the open enrollment period for 2017 coverage. This year, which we'll talk about in a little bit, we see that coverage is at a really good pace for open enrollment. We have about 6 million people being covered on insurance plans for plan selections made so far, but we've only got a couple days left instead of several weeks left.
Right.
So
a lot of the advertising was cut, funding for the navigators were cut, so the cost-sharing reductions were defunded from the insurance companies, so there was a lot of things that upset the marketplace and destabilized the marketplace. So despite efforts for market stabilization activities, these were destabilizing activities that caused a lot of concern in the marketplace. But through it all, we still see Obamacare holding together, the Affordable Care Act holding together, and still providing some decent services for people out there that need health care coverage.
So when you say that outreach was cut 90%. That's a dramatic wedge and wrench into the ability for people to find healthcare.gov and start signing up.
Now, the one thing that we can look at is the fact that this is not the first open enrollment period. So we knew that people were much more familiar with it than when it
in
didn't
2013,
unroll at the very beginning in 2013 when it crashed. But so there was some time for people to get used to it, to understand the process. So you could see that there might be less of an emphasis on outreach and education as the program becomes more mature. But the cuts that they put in were so significant, it was like dropping off a cliff. Shortening the time period so dramatically also, efforts to design to really, it seemed as though it was sabotage.
That's the word that you heard the most.
And it seemed like, that could be true.
And some of these changes are very ironic. Not only are they ironically named, but defunding cost-sharing reductions. The law still says that the insurance companies have to pass along cost-sharing reductions to individuals who qualify for them. The change that was made is that the insurance companies are just not going to be paid by the federal government for passing along those savings. So that was done in an attempt to save money by the feds. But the insurance companies aren't going to eat that cost. They want to make it up, so they pass it on to the consumers in the form of increased premiums. But the feds then have to pay increased tax subsidies to make up for it.
So it's paying, robbing Peter to pay Paul. It was really, it added to the deficit.
It made it worse.
It added to the deficit. So it was
more expensive in an attempt to save money.
It makes you see where the real intent was behind this, which was more to try and destabilize the program versus to actually save money.
Right. It was a misnomer. And I think people are wise enough to see that that's what actually transpired. So now we've got even more stuff going on. We're not done with the calendar year yet. We've got the Senate and the House working on reconciling a version of the tax bill, which includes a significant number of changes that could potentially impact health care and coverage.
Right. And the tax bill is working its way through. There was an agreement today. Democrats are upset because Senator Jones, recently elected in Alabama, won't be seated until January, so there will be a lame duck person from Alabama voting on this, and that's causing a lot of consternation. The people of Alabama have spoken, but their voice won't be heard. So that's going to be unfortunate. We'll see what happens. I mean, we're still waiting to see if this bill actually gets the support of people like Susan Collins, John McCain, and others. So
like Lisa Murkowski, who voted no before.
Yeah, but she's got some of her oil exploration pieces in.
There's other motivations. Right. Yep, which is what you have to take into account. It's not just the healthcare piece as a standalone anymore.
But also CHIP. We're waiting for CHIP, and CHIP is the Children's Health Insurance Program. It manifests itself in Wisconsin through Badger Care, and it's a program that the state relies on to support some of the healthcare coverage for children in the state. It comes in an enhanced match, and Wisconsin says it has funding through maybe March or so, but a lot of other states are running out of gas soon. Minnesota is having trouble. Some other states are having trouble. So it's important that CHIP is reauthorized. It is something that is receives a lot of bipartisan support. It has for years since it was started in the late 90s. But I think right now, how do you pay for it? And one of the issues that has come up is the fact that we have this enormous tax bill increasing the deficit, and now people are saying, well, we don't have the money for CHIP anymore. Where are we going to get the money from? So people are saying, well, you just increase the deficit with this potential tax bill. It's not passed yet, but it means that CHIP is in some ways held hostage to the deficits that are being driven by this possible tax bill.
It's one of those, CHIP could become the next unfunded mandate. CHIP is reauthorized on the books through 2019. What we're just trying to find out, as you say, is the money that needs to be delivered to the states to actually cover 9 million children. So the consequences are huge.
Recent chatter has been that the next funding bill, because the government's going to run out of money again on the 22nd, so they have to do another reauthorization, and there's been discussion among some more moderate Republicans that we need CHIP as a part of the next reauthorization. They did include some money in the last continuing resolution, but they want a permanent fix after the 22nd. We'll see if they get that.
Yeah. In the background, as we're talking about the impact that CHIP would have on Wisconsin, that's for largely children. We also have to worry about our adults without dependent children in Badger Care Plus. The state of Wisconsin bringing us full circle to that waiver flexibility we talked about right from inauguration day forward. Wisconsin has asked for a Medicaid demonstration, Section 1115 waiver, to be able to implement things like drug testing and premiums and work requirements on our adults without dependent children population enrolled in Badger Care Plus. That's still pending, but that's a sign of states taking advantage of that flexibility that was just granted to them. So we're gonna shift gears to start talking about some of the shining lights and the hopeful moments out of the last year as repeal and replace was working its way through the legislature, and it was a very difficult summer. There was a glimmer of hope, and one of those glimmers was the bipartisan Senate Help Committee. This is the Health, Education, Labor, and Pensions Committee that said, you know what, we're going to have our own hearings. We're actually going to talk about market stabilization. We're not going to use that as a buzzword. And they invited industry insiders, hospitals, advocates, experts to come in and give their ideas of what would be a good way to take what we've got and make it better. Where are some of the holes in the road that we can patch and make this a workable solution? And they invited Andy Slavitt in. And he testified, and our listeners will probably know Andy Slavitt as the former CMS administrator in the Obama administration, very active, working with healthcare.gov from the start through the end of the Obama administration.
Right. The Senate Help Committee identified some compromises. It was Republican Lamar Alexander of Tennessee and Patty Murray of Washington that really came together in a bipartisan fashion and helped to create a bill to hopefully, move towards that repair of the Affordable Care Act and then actual replacing and repealing. So it's hopeful. I think that in the tax negotiations, Senator Collins of Maine was saying we want to see aspects of that bill approved before I will vote, or a confirmation that this will get approved, or that the bill will be brought to the floor before she's going to vote for the tax bill. Now some people are saying Senator Collins could withhold her support for the tax bill if this deal isn't put forward, because our own Congressman Ryan from Janesville has said, it's not my deal. I wasn't part of those conversations, so I might not be interested in putting in some of the provisions of the Help Committee compromise into a new law for the Affordable Care Act.
And some of the compromise and suggestions coming out of the bill are very practical. Some of the risk stabilization measures, risk corridors, some things that should have been in the first bill but are not funded that were part of the Affordable Care Act, just makes sense to help spread that risk and stabilize.
It's part of the whole risk stabilization, reinsurance, and people call it different things, high risk pool, but I mean invisible risk pools. The whole point of it is that when you open up a program without any underwriting, there will be some risk, and there probably needs to be some mechanisms to help
just balance it
out a bit and stabilize that pool. So it was in the Affordable Care Act. It would have to be, if in any format, if there's not going to be any pre-existing condition period, then you would have to have some sort of market stabilization. So it's going to be there. What's it going to look like? We still don't know.
Right. Bending the cost curve. We just had a report, CMS themselves were the ones reported, that in 2015 we are seeing healthcare costs still increasing at a pretty fast clip, 6% increase more or less in healthcare spending. We talk about the improvements that can be made to bring healthcare costs down across the system, getting more people connected to insurance and to third-party payers, getting more people into preventative care and services, and seeing regular doctors instead of being frequent users of the emergency room. Well, this new report coming out of CMS from their data center, as first published in Health Affairs, gives the notion that in 2016, that rate of health spending increase was at 4.3%. So we are seeing there's still increase in healthcare spending, but it's at a slower pace than before. And a lot of that can be attributed to people being connected to coverage and using the healthcare more wisely. Some of the hospital spending being a little bit more under control, and also some of the prescription and pharmaceutical usage being a little bit more in control.
I also see, this is part of it, and we talk about this quite a bit, and that is the fact that if we have more people covered, there's less uncompensated care and less cost shifting that occurs. So we saw that in Wisconsin, where uncompensated care dropped pretty rapidly from 2013 to 2015, from over 1.5 billion to almost 900 million. It's going up again, though, because as people destabilize the Affordable Care Act, less people are joining the plans, more people are uninsured, uncompensated care will increase.
Well, one of the things we mentioned very quickly before was the fact that despite the market stabilization rule and all of the upheaval to healthcare.gov and to the marketplace in general over the last several months, enrollment is up. The last snapshot, week 6 snapshot, was made available by CMS this week, giving us numbers through December 9th, telling us that about 4.68 million people have made plan selections, covering just over 7 million individuals, if you were to count all the household members on those applications. This is a much faster clip than last year. We're seeing more people find their way to the marketplace, make their plan selections, and get ready to go for coverage for the next year. And in Wisconsin, we're at about 128,000 people.
Shorter period, though.
But this is the thing, we're running out of time. Open enrollment ends December 15th, so we're a lot shorter than we were in past years. We got a long way to go. So a faster pace is good, but we need to keep that up for another couple of weeks to make sure we get everybody covered that needs it. One of the last big things we wanted to mention just from 2017 is something that's personal to us at ABC for Health and Health Watch Wisconsin, and it's the topic of birth cost recovery that we've been dealing with. So we are shifting gears a little bit away from our ACA and Marketplace and Badger Care Plus conversations. Talk about this policy.
This is a point of emphasis that we began this summer, working with some volunteers and interns and staff that have worked on this issue for a long time, like Mike Rust and Rich Levine, myself. We put a work group together to do some research and some study to identify what are some of the trends in birth cost recovery in Wisconsin, where's the money, how much money is coming in, where is it going, how much are counties keeping, what's the harm to children and families. And of course, this is an issue that we've been concerned about for a long time. We're concerned about the impacts on access to prenatal care. We're concerned about the impacts of money being taken away from families. We're concerned about the impact on children and poor birth outcomes. Wisconsin has an infant mortality rate that is, in some communities, more like the third world than the United States of America, and that's troubling. And there's something we can do about this. If we're concerned about access to health care coverage and services, if we're concerned about disparities, if we're concerned about the impact on racial minorities, this is something that we can actually do something about. Communities like Madison, Dane County, Milwaukee County have an opportunity to apply some discretion to some of the birth cost recovery judgments, that they're just sort of rolling through the process. It's steamroller justice. A lot of families get caught up in that, and it shouldn't be done this way. The majority of states across the country don't do it. Wisconsin is the leading state in the country. It's a problem, and we want to change it.
Yeah, we've got a lot more information on healthwatchwisconsin.org. On this topic, a webpage devoted to birth cost recovery, some of the letters, some of the reports that we've written.
Big research page, so have some fun looking at our past research, our current research, and join our efforts, because we can use the help.
And we've gotten a group of partners and community members together that are very interested, and we want that to keep growing. So we end today by thanking you for sticking with us in 2017, for being a part of either the services or the learning that we provide here at ABC for Health and Health Watch Wisconsin. Challenging times have made people very creative and innovative in ways to deliver services to people that deserve health care and coverage and are entitled to some of these rights and responsibilities that come with the programs. And we know that you've been a big part of that over the last year as well.
Yeah, thanks a lot, all you health watchers. We appreciate your support, and we look forward to 2018 and working with you again to help make Wisconsin a better place for access to healthcare and coverage issues. And we'll see you then.
See you in 2018.